Okay, so let's get started. We're exploring safety and infection control, one of the 8 client need areas on the NCLEX. And these slides should be included in your email where you got access to not only these slides, but practice questions and some Google Doc notes as well. So let's go ahead and move through this particular mini lecture as there are a lot of notes to share. All right, so the test plan for the NCLEX is included here. So if you were to click here, it'll take you out in a new screen here to the NCSBN website where there is the Next Generation NCLEX. This one is the RN test plan, but of course, there is also on that website the NCLEX-PN test plan. And I encourage you to check it out and read it in its entirety so you can get a good sense of what this test is all about, right? I like to go to the horse's mouth. I like to go right to the makers and developers of any exam that I take with the idea that, yeah, they're probably going to give me some clues as to how I might best study. So let us just take a look at what I believe are the most important things for this mini lecture. All right, let's get right to the heart of the matter. We are looking at the test plan structure, and specifically, we're looking at these 8 client need areas included here because why would I focus on this area? This is where you're graded. This, if you've ever taken the NCLEX before, there's a candidate report that comes back to you, and it's broken down how? In these 8 sections. So you either pass or near passing or below the passing standard for each of these, right? So I like to hone in on what's most important. And right here is safety and infection control. Let's go ahead and click on that there, and it'll take us to page 8 in the NCLEX-RN test plan. Probably a similar page for the NCLEX-PN, but definitely check it out, right? And it's going to break it down, safety and infection control, and what it's all about, protecting clients and healthcare personnel from health and environmental hazards. All right. So here are the bulleted items, or concepts that describe what they're testing. Okay, assess client for allergies and intervene as needed. Assess client care environment. Promote staff safety. Protect the client from injury. Properly identify the client when providing care. Verify appropriateness and accuracy of a treatment order. Participate in emergency planning and response. Use ergonomic principles when providing care. Follow procedures for handling biohazardous and hazardous materials. Educate the client on safety issues. Acknowledge and document practice errors and near misses. Report, intervene, and or escalate unsafe practice of healthcare personnel, i.e. or e.g. substance abuse, improper care, staffing practices. Facilitate appropriate and safe use of equipment. Follow security plan and procedures, e.g. newborn security, violence controlled access, or violence, controlled access. All right. Apply principles of infection prevention, e.g., hand hygiene, aseptic technique, all right, isolation, sterile technique, universal standard, enhanced barrier precautions. All right. Educate client and staff regarding infection prevention measures and follow requirements when using restraints. All right, some of these have more than one page, but we can sum it all up here in this one page bulleted list. Okay, so are you surprised to hear that, some of these are under safety and infection control? Well, guess what? All of the NCLEX is really about safety and infection control. Really is. It's, well, safety at least. All right, so there is the NCLEX test plan explaining to you exactly how you might think about these questions before you even see them. All right. And some of the highlights I list in my bulleted list here. All right. The National Council of State Boards of Nursing, those are the test writers, creators. All right. So, again, familiarize yourself with that plan. All right. Oh, I had a couple of bonus pages in there that I could probably go ahead and remove. All right. The NCLEX test plan is broken down here in for both the RN and the PN, all right, and it gives you some input on, just some specifics about the test plan, how long it is, the delivery method, the pass-fail rules. But if you're watching this supplement, then you've already heard me break that down. So definitely go back or refer back to the initial videos that I sent you at the very beginning of the class that would have contained a description of the test plan. Okay, so for that reason, I'm going to move on along. All right, so safety and infection control. I made a word cloud here that really captures a lot of the terms that I just read to you in the NCSBN test plan description list there. So you'll see that, but I entered them based on the frequency of the words that are presented, and see what stands out here as the largest word. The larger the word, the bigger the word, the more readable the word, right? The more it appears on the NCLEX test plan. So safety is a big word here. Universal standard precautions, barrier methods, disasters, right? So that's just to kind of put you in the mindset for what we're getting ready to study or approach today. Now, I don't want to spend too much time on this candidate report. It's just to reflect back to you, though, that each of the 8 client need areas are covered in your candidate report. So, hey guys, this is the goal, right? You want to take this test so that you can pass or be above the passing standard on each of the 8 client need areas. They're only slightly different for the RN and PN, but we both do have safety and infection control. So I'll focus today on the similarities and not the differences, but when the differences appear, they're usually here in management of care, which for the PN would be coordination of care, and pharmacological and parenteral therapies, which for the RN includes the parenteral, but for the PN, there's pharmacological therapies only. All right, no parenteral therapies, so no IV administered drugs like TPN, blood products, or platelets, so that includes the blood products, and IV meds. Okay, all right, so moving forward. Now, I've probably already talked to you about this if you've taken my prep course. And if not, I just want to quickly say that the NCLEX Next Gen has kind of transformed the traditional questions that we're used to seeing, or those item types, and transformed them to make them a bit more capable of pulling out of the test taker all kinds of knowledge. Okay, so your knowledge has to be strong before you go in to take this NCLEX, because the new question types are a little more complex, and they do require a little bit more detail. But one thing I will say, in meeting and talking to students who have taken the test, it's pretty fair and straightforward. All right, and not as tricky as people suspect it may be. All right, but here are the former test types or question types. All right, and they do include the hotspot question, right? The multiple choice question, the chart style question, the select all that apply question, the ordered response or the drag and drop question, and the fill in the blank question. Again, for more about that, check out my videos that I created on NCLEX question test styles for more details. All right. So those were the old gen or classic questions. These are the next gen questions or the new types. All right, and they're going to include the highlighting style questions where you use an actual highlighting tool within the test to demonstrate to the algorithm which of those findings you would select. All right, there's also the multiple choice matrix grid, also the multiple response matrix grid, pretty straightforward. They look like multiple response and select all that apply questions. However, they tend to have more than one column of answers. All right. And usually it's like asking you what's indicated or not indicated, what you might do versus what you might not do for that client. Okay. So with that said, it's pretty straightforward. And then there's the bow tie question. The bow tie question style requires a little bit of um, explanation. However, it's basically just a drag and drop question with 5 targets. And then there's the select in, a little variant on the select all that apply, but they give you the number that you need in order to answer the question correctly. And then there's the drag and drop style question, as well as the drop down close question, where you're answering a sentence or a couple of sentences using some options provided. Now, I know these are super tiny, hard to see, but again, check out the videos for more details on that. I just wanted you to know that this NCLEX has transformed, and that 10% of your questions will be next gen. All right, so here's a document here that kind of breaks down the new clinical judgment decision making model that NCLEX or NCSBN uses to structure the new case studies. You'll notice there are 6 colored boxes here that correspond to the 6 question types on the case studies. Well, not question types, I should say question um, focus or question, yeah, emphasis, right? So each of the 6 questions will be driving home a particular focus, right? So, in other words, the first question will always ask you to assess the client or recognize cues. And yes, there is overlap between the nursing process, 5-step nursing process, and this 6-step clinical judgment process that we're using to overlap or uh, there is a one-to-one overlap in this model and the 6 questions that you'll see on each case study. All right. If you want more detail about how these case studies are set up, again, check out the videos from my earlier classes. Okay. With that said, we're going to move on beyond this concept so that we can kind of explain a little bit those 6 pieces. I use the RAPGTE or RAPGTE protocol, like it's a mnemonic that helps me remember the 6 steps in a case study. All right. And the R is for recognize cues. The first question is always going to be asking you to recognize some assessment signs. The second question is analyze cues, right? The second question is always asking you to kind of organize and connect the cues that you saw in the first question, and then kind of think of what you might be working here with your client. Like you're kind of just using your knowledge to and your observations after assessment to kind of think what's going on with this client. The third case study question generally wants to know what you think you're dealing with. What is this client at high risk for presenting here? So you prioritize the P in RAP GTE. It's for prioritizing a clinical diagnosis or hypothesis. All right. And then the G phase or the fourth question is about generating a solution. In other words, planning. This is the one that overlaps with the planning phase of the nursing process. And if you're a PN going, well, am I really planning? Well, absolutely. For these case study questions, you are going to be involved in the planning or the care plan. So the wording, pay attention to the wording, because usually for the PNs, they're asking, hey, so what are you going to do to help in developing a care plan for this client? So care plan is usually happening in the fourth stage. And then the fifth question is take action. all right, or implementation in the nursing process. So we take action implementing solutions that we came up with based on the priority that we set. And then finally, evaluate outcomes. And again, for my PNs, evaluation in these case study questions will be definitely based on your working with the client. They're giving you these new assessment findings or new cues, and you looking back to say, well, how might I judge where the patient is now? Okay, so evaluating outcomes, although these evaluating, planning, educating the patient, all that tends to be around delegation or questions around scope of practice. On these clinical judgment case study questions on the Next Gen NCLEX, you're really being asked to explore this 6-part process in its entirety. Okay, so definitely for more about that, I also had those videos on this clinical process, so you can definitely check those out. All right, but moving on to today's resources and what you might use to help you with focusing in on safety and infection control. Well, here's the link to the Google form. All right, if I were to click here, it's going to take me out to, let's see here, the form that we are going to be completing today. All right, at the end of our topics, we are going over into safety and infection control questions. Okay, that will help us test our knowledge. Okay, so that's Google form. That's where you can get back to that. Now, in Nearpod, we have 3 different questions. Well, Nearpod is a kind of an educational platform that helps people engage with questions asynchronously. In other words, you can click on this at any time and it will take you back to this question. You'll just enter your name or your nickname, and then it'll jump you right into a self-paced lesson. Now, I break down the individual questions that you'll find there in case you want to come back, work with that question outside of this practice test, right? Google form has some additional questions for you. Okay, so we'll get to that in a minute. And then finally, Google Doc. The notes that we'll be discussing today are here in the little mini lecture that I will do, will be contained in this Google Doc. Okay, so I just want you to know you can get back to all the links to materials that you see on your screen today using that form. All right, so let us move into our lecture notes. And by clicking on lecture notes here, you can get there. All right, so there's one way to get there. All right, and you'll notice now that we're here that you can, oops, that's not right. All right, you will notice that you can get back here. You can get to these notes. Sorry, apologies. I got distracted there. You are able to get back to your Canvas slides, the ones that we just left, by clicking here on this hyperlink here. All right, so the practice questions, the Google slide, the Google forms are here. All right, so I try to give you the slides and links and access to all the learning materials in multiple places so that you can find your way back to what's useful. All right, so let us now begin with our talk on safety and infection control. All right, let me just kind of leave things here. Okay, so I want to start with, and hopefully you have your notes in your screen, but you also have them, you have it so that you can see or hear me, okay, as we go along. All right, so let's start by defining the standard precautions, all right, versus the universal precautions, and we'll start there. Okay. So the standard precautions are the ones we're using for the patients every time, every patient, every time. Right. And they are going to include the following, right? Hand hygiene, right? So you're doing this for every patient every time before you're entering the room and upon leaving the room, all right? And you're regularly doing that. That's the regularity. But you're also using good hand hygiene when necessary, all right? So not just when entering and leaving a client's room, but also when your hands are soiled or when you've come into contact with a patient in any way, particularly with their bodily fluids. All right, so that's why you're kind of doing it before and after you enter a patient's room, but you definitely want to do it as needed when there are, anytime you come into contact with the patient's garments, the patient's bedding. I mean, it's really kind of protocol for you to work with your clients. You don't always have to have gloves. Like, hopefully, you're not using your gloves when you're just taking vital signs, unless patients on contact precautions. All right, and then you are going to use gloves. But other than that, it's just not routine to use gloves when assessing a patient's vitals. All right, so personal protective equipment will include all those barrier methods that you might use, like gloves, masks, gowns, and eye protection. And you're using these things when necessary, when you're undergoing or abiding by standard precautions, right? In other words, if you were working with a client who, say, for example, was pregnant and they were entering into the first and second stages of labor, right? Well, let's go first stage of labor where you have the three phases. And at any point, we could have a rupturing of the membranes. Now, if that happens and you're working with your client in a close setting, right, perhaps a face mask or even goggles might make sense there. Even more so if the patient has a communicable disease. Okay, so you definitely want to pay attention to these safety and infection control questions and consider not just always the correct way to respond, but sometimes the best way to respond. And generally, when you're responding to best questions or most questions, you're really having to use your critical thinking, and it's not always so black and white. All right, so you definitely want to consider splashiness, all right? And that can help you determine whether or not you also need eye protection and or face shields. Respiratory hygiene. So that's gonna, we call it sometimes just cough etiquette. I like to think about it like that. Hygiene, covering your mouth and nose with a tissue, or sneezing into an elbow or coughing into an elbow. Make that a good practice that you're doing. But again, these are all standard precautions, things you're going to do with every patient every time. Safe injection practices, okay? So we're using sterile equipment and proper techniques for the administration of injections. Safe handling of potentially contaminated equipment. Of course, we're disposing of our sharps properly, which means what? In the sharps container, absolutely. And we clean reusable equipment between uses, right? Safe handling of contaminated surfaces. We clean and disinfect regularly. And like understanding the difference between cleaning and disinfecting, very important. Okay. Like what type of cleaning involves uh, uh, I'm thinking more of the industrial grade cleaning products versus those that literally kill pathogens. Okay, so hopefully you have a little bit of thought around that. Then there's also sterilization. All right, so is this an item that can be sterilized in the autoclave? All right, is there an understanding around the safe handling of contaminated things? All right, proper waste disposal. All right. Are we thinking through guidelines? Now, these questions around guidelines and protocols tend to have NCLEX question stems that may ask you, how, what What are you most likely to do in a scenario with a patient who has this, communicable disease or this risk factor that you're trying to maintain standard precautions for? All right, think about your regulations. Regulations usually set you up for best and most likely questions on the NCLEX: hand hygiene, right? Or waste disposal, or overall standard precautions. All right, we've got occupational health and immunization. Of course, all of that will reduce the likelihood of spreading disease, right? Because we're using, again, protocols to manage the community and keep those at risk communities properly immunized. All right, patient placement and rooming. All right, is your patient uh, ill with a communicable disease, and can they cohabitate or be co-assigned a room with a client who has a communicable disease? Well, depending on the scenario, yes, they can, right? But we'll talk about that a little bit more in a moment. All right, education and training. So, very much a part of safety and infection control and standard precautions means that we need to update nurses regularly, right? And at all levels, we need to update regularly to make sure that infection control practices and procedures are being followed. So that I would call standard precautions, whereas universal precautions, right, are going to include. Oh, I got my copy incorrect here. But universal precautions generally are those precautions that we're thinking about when working with clients who are undergoing surgery, right, and require sterile technique. Okay, these aren't just the standard precautions that you're going to use with every patient every time. These are more likely to be very focused on those patients that are particularly at risk for contamination or infection, right? So, peri-surgical patients come to mind. So, most definitely know these, your universal and your standard precautions. They're generally ones that you use across the board. We'll also talk momentarily about situations where the patients have very specific infection precautions. All right. But just knowing that overall, what we're talking about here have to do with barrier methods, PPE, injection safety, environmental cleaning and hazmat, respiratory hygiene, patient laundry handling, and room assignments. All right, so let's move forward first with infection precautions. We'll start with contact precautions. So, contact precautions refer to those diseases that can be caught from anything enteric. All right, so when I say enteric, I'm talking about the intestines, fecal, oral, right? The alimentary canal. So, from the mouth to anus, we're considering um, those diseases that can be caught from those areas to be uh, contact diseases. Okay. So, what might they include? C. diff, okay, is in there for sure. Big time contact disease. I often think of C. diff first when I think of diseases that require, or conditions that require contact precautions. All right. Because it's so messy, it helps me to think about all that I might do to protect myself in the right PPE. So, is that what you're thinking when you think of the different communicable diseases? Are you thinking of the PPE that goes along with them? Well, I hope with this lecture you will think more directly about that. Okay. Hep A. We say A is for anus. All right. So anything also, one way to keep up with your hepatitis conditions, A and E, all right, is that anything with a vowel comes from the bowel. Okay. Hep A. Anything with a vowel comes from the bowel. That covers Hep A and Hep E. Okay. And I like to think of Hep B as, okay, B for blood, right? So you're thinking about the blood-borne pathogens there. Well, shoot, that covers about three of the hepatitis versions that you might get on the NCLEX, right? And C, I always think of cirrhosis, Hep C. I always think of cirrhosis, and that brings me back to liver stuff. All right, so Hep A and E are definitely going to put a person on contact precautions. All right, cholera, dysentery. All right, cholera, both of those. Well, let's say first, cholera is uh, it's more of what we might consider to be a world community disease or communicable disease, because it, for the most part, has been addressed in most for first and second world countries. All right. With that said, it's still a problem. Dysentery is not necessarily a particular communicable disease pathogen. It's just referring to any kind of diarrhea of unknown origin. So if we don't quite know why this person has this diarrhea or bloody diarrhea or whatever they're presenting, we're going to put them on contact precautions until we figure out what's the cause, because it could be Ebola. All right, Ebola comes with a fever and a serious diarrhea that is pretty extreme, right? And until we know what it is, we'll have that patient on contact precautions. So, just some of NCLEX's convention around that idea, dysentery. Okay. All right. So, who else is on contact? People with medication resistant infections, MRSA, VRSA. All right. They may have, some kind of pathogen resistant uh, antibiotic that they've been taking, but they didn't take it completely, and so the infection returned. All right, and so in this way, often we have medication resistant infections lurking out there in the community. And if a person catches a medication resistant infection from someone, right, communicable disease, from someone else, they too will have a medication resistant infection. So when this happens, typically we put them on contact precautions, and then we have to sample a few antibiotics until we can get to one that's actually going to do the treatment thoroughly and rid this person of their infection. Okay, so, but until in the meantime, all right, we put them on major contact precautions. Staph wounds, all right, Staphylococcus aureus will be problematic if you are working with a patient who has the draining staph infection. Okay, now we're not even talking about the medication resistant version of a staph infection. We're talking about just a general staph infection. All right, it doesn't have to be MRSA or VRSA. It could just be a staph infection. If it's draining, all right, we're going to put them on contact. All right, if there's exudate or any type of you know, um, pus or drainage from the wound, we're going to go ahead and put them on contact. RSV, respiratory syncytial virus. So now it's what the babies get, but now we're hearing more about 60-year-olds getting RSV. Yeah, it's a pretty I wouldn't say it's benign, but it's really more problematic in people with compromised immune systems, like your older adults and your babies, and people who have uh, other reasons to have immunocompromised systems. So, with that said, it's okay to room two people with the same pathogen. Okay, we like ideally for them to be cultured first so that we can know that they are the same pathogen, but sometimes you get like two students coming in, both with mono from a dorm, or both with some type of medication resistant infection, maybe even meningitis, from the same area. So, you can almost cohort these people on the premise that they likely got this from each other. Okay. So with that said, we can put these folks on on contact precautions together in the same room. All right. And why contact when this is a respiratory disease and maybe we would consider putting them on airborne? Well, because they touch their toys. They touch things, these 1 to 2 year olds, and they drool all over everything. So at this point, we've gone from a respiratory scenario to a contact. Okay. Rotavirus, norovirus, flu, adenovirus, skin infections like chickenpox and shingles. Notice that there are several of these that would also fall under droplet or airborne precautions. And where that happens, you're certainly going to want to first prioritize contact precautions, okay? But knowing that putting someone on contact precautions and droplet precautions will only, kind of vary by just a little bit. I'll focus in on a second on the difference between the two. All right, but in impetigo, lice, scabies, herpes, skin diphtheria, all those skin infections would be included in there, okay? All right, pulmonary infections, RSV is there, okay? As we mentioned before. Parainfluenza, eye infections, including conjunctivitis, and herpes infections, including herpes zoster, which is shingles. Herpes zoster tends to be is caused by varicella, which is the virus that causes chickenpox. But it shows up as herpes zoster decades later, in older adults generally who were exposed to chickenpox as children. And it's kind of in the nerve endings, and there can be much discomfort from the long-term sequela of having that virus in the person's nervous system or nerve endings for all that time. All right. So with that said, these are all contact precautions as well. Okay. So what do we do for the person on contact precautions? Well, we put them in a private room. That's preferred. Two of the RSV kids or the meningitis kids, they can go in the same room if they're both positive. That's cohorting. All right. You don't need a mask or or an eye shield or face shield unless it's for universal precaution reasons. And remember, those are more like PRN decisions that we're making in real time based on what's going on with the patient. Okay, so you may need an eye face shield for someone who is, as I mentioned before, draining, or potentially there's a opportunity for splash, or maybe they have C. diff and you're working with your sheets and you don't want to get the splashy sheets, you know, uh, to splash in your eye. Okay. So with that said, check out the differences and the nuances in your patient presentation. All right. No special filter mask, right? They don't need N95 masks. They are not they don't have airborne diseases. The patient doesn't need to wear a mask, all right? And they don't need a room with a negative airflow, or what's called a negative pressure room, all right? What they do need, however, will be gloves and gown, all right? And we're going to do hand washing. And maybe we have specific supplies or dedicated equipment in those rooms. All right. In other words, have the kids' toys, those kids with RSV, leave the toys in their room. Don't take them in and out for others to play with, and disinfect them before having them be used by other patients or uh, other family members, that type of thing. So dedicated equipment, having the one person with contact precautions using the equipment only. Disposable supply, dedicated vital signs equipment, so like thermometer, covers, blood pressure cuff, or even hats. You know how we have, well, that's definitely reusable, right? The urine hats, but all that, they stay in the bathroom or in the room. All right. And then follow standard precautions as well. All right. So that's thinking through things like having to wash your hands with soap and water when the patient has C. diff, right? Because hand sanitizer or alcohol based hand sanitizer will not work. All right. So that's contact precautions. Let us now move on to droplet precautions. So droplet precautions are going to cover those large pathogens. And when I say large, I mean those that might travel 3 feet on like a sneeze droplet, right? Or a coughing droplet. So a person projects um, out of their oral cavity. Sometimes it's other cavities, right? But again, it's enteric usually, and Well, not usually, not always, but the patient sneezes, coughs, the droplet comes out of the mouth, goes 3 feet, falls, dries, and then falls down and then dies, right? Becomes inert, can't hurt you. After it travels that 3 feet, falls on the floor, it dies. All right. But when they're still wet before they dry or desiccate, they can actually enter through your eyes, nose, mouth, and mucous membranes. All right. And so those droplet problems usually are a problem when people are in close vicinities, all right, or close quarters, right? So your meningitis, yeah, that could be a droplet disease, right? And usually we want to culture these folks through lumbar puncture. Lumbar puncture is the way we find out what these folks have. All right, what we have suspicion. So you definitely want to check out the meningitis care plan so that you can see those unique assessment findings that make it meningitis. Okay, you want to be able to identify the unique signs and symptoms on the NCLEX and know that these folks can be boarded together again or cohorted when they've been cultured. All right, Hib flu. All right, that's Haemophilus influenza B. All right, this is the flu that causes epiglottitis in those kids, right? So the youngsters, the really young kids, right? The toddlers and under. So that's why we give Hib flu vaccines like the day of birth or even the day after. But usually within 24 hours of the birth, we're getting this vaccine to the baby. It causes epiglottitis, which is an airway issue. I mean, if we don't pay attention to epiglottitis on the NCLEX, we miss the fact that this is a really high risk disorder that could take a baby's airway. All right. So, and that's why we sometimes, in bad cases where there's all the swelling of this, soft tissues around the throat and, in the oral cavity or in the back of the oral cavity, we might insert a tube down there to keep things nice and patent. All right. So, and I don't mean a tracheostomy. That which could happen. That's kind of the worst thing that could happen with a patient with epiglottitis whose airway isn't maintained or protected. All right. So to prevent all that threat, we give them immunizations in the first days of birth. Diphtheria, meningococcal influenza, mumps, pneumonia, parvo, fifth disease, plague. You might be saying, am I going to have to remember all these droplets? Well, there are more droplet diseases than I feel like a lot others. So let me just show you really quickly before we go over those precautions where I've housed some mnemonics that might help you with thinking through the different diseases that go along with each of the different communicable areas, like airborne versus droplet, right? Droplet, have you ever heard of Spider-Man? Spider-Man but with three S's, right? For sepsis, scarlet fever, streptococcal pharyngitis, like three P's for parvo, pneumonia, and pertussis. I think it even has three M's for mumps, meningitis, and meningeal pneumonia or mycoplasma, which is kind of TB, right? So have you thought about the three? Have you thought about the three? Um, the droplet precaution Spider-Man mnemonic, where there are three letters for the S, the P, and the M, right? Everything else is kind of implied. Influenza, the I, D for diphtheria, E for epiglottitis, R for rubella, and then look what they do. They shove A and N together and call it adenovirus. All right. So if you're the type who doesn't mind learning a mnemonic, sure, this could be a good way for you to think them through. But honestly, NCLEX cares more that you know about the ones that create more of like an airway issue or major safety issues, or ones where things can, I like to think that way, like which one, in which scenario can things really go wrong? Or what are the patterns on the NCLEX around these types of questions, all right? And I do see a lot of German measles questions or rubella questions. I do see a lot of strep, pertussis, influenza. If you see the others, often they're like the ones you don't want to pick, like parvo, fifth disease. They're not very common or popular. So don't be inclined to go for the tough ones that no one's ever heard of. Focus on the ones that we really struggle with in terms of getting patients to immunize for, or ones that are more deadly, cause more problems with airway, or, just in general are much more uh, problematic or life threatening than others. Okay. Ones with high fevers, one with, airway issues. You definitely want to know those. All right. So, droplet precautions. What are they going to include? Let's start with the private room unless cohorting. All right. You will see that for droplet and contact. Private room preferred unless cohorting based on positive culture. And it's lumbar puncture with meningitis. Sometimes it's an actual culture and sensitivity test with patients to see which pathogens they actually have. Okay. Now, what are we not going to have in terms of PPE for droplet precautions? Well, no gown. No gown. Is that counterintuitive to what you know? No eye face shield is required. No special filter mask is required. And no negative airflow room. All right. But yes, look at all the yeses. Dedicated or disposable equipment. Always wear a surgical mask. All right. We're going to come in closer than 3 feet to our client. So we do need a mask so that what's in, maybe the patient's talking to us and suddenly they cough. If they cough into our oral mucous membranes, we may contract what they have, particularly if it is influenza, mumps, pneumonia. All right. So strep. All these things are things you want to focus on as possibilities if you do not wear the mask. Wear the mask. All right. Follow the standard precautions as well. So, hand washing when necessary, wearing goggles. When you're suctioning a patient with one of these droplet diseases, all right, you need the goggles for sure. All right. So, again, when you're thinking through standard, you're thinking through through universal and standard, you're thinking through how your patient scenario will cause you to get the proper PPE that's needed, or you're thinking through the actual protocols that are required for these different techniques, all right, like aseptic technique, or even what's happening in the surgical environment. Okay, so definitely you want to be able to think through proper PPE. All right, the door can stay open in a client who's in a droplet room. The door can stay open about 3 feet. All right, but you don't want the patient within 3 feet of their of their family, their loved ones. You definitely want them uh, to keep that 3 feet distance. Now, the patient should wear a mask when they go outside of the room. All right. Because again, what if you're in an elevator transporting your patient down to imaging, and on their way down there, they have a coughing fit in the closed quarters of uh, the elevator, all right, then there's always that risk that you might actually communicate a disease to another patient in the hospital who's vulnerable or immunocompromised. All right, now let's move on to airborne precautions. So, airborne particles are smaller than droplet particles. They travel further and they don't die when they dry out. They actually like dry out and they become something else. They become something called a nuclei residue particle. And they stay suspended in the air. Oh my gosh, waiting to get into vulnerable lungs. So, this you're going to see some diseases that actually were technically droplet, but these folks, because of the nature of the disease, is particularly the fact that there's always this projectile coughing and possibly sneezing that could put that patient at risk for having these droplets enter their lungs. Right, the lungs are the vulnerable place too, not necessarily the oral and mucous membranes. It's the lungs, right, where we're worried, because these pathogens get into the lungs, then we got a problem, right? We have a similar problem with risk for infection. So measles, mumps, rubella, TB, all technically droplet, but the patient's put on airborne. All right. Varicella is technical chickenpox, right? technically contact, but they're put on airborne precautions. Did you know that kids with chicken pox, they cough a lot and they can spread that disease? Okay. Um, yeah. So airborne is the chicken pox is a very interesting one. Varicella, it's very interesting. It's definitely contact because they have the all the plaques and scales and vesicles are really what they're called, vesicles that burst open on the kid's skin. Well, they burst open and that makes some contact because there's oozing and some kind of virus filled pus that comes off those little vesicles, pustules on the skin. All right, but there's also a airborne component to chickenpox where the kid is putting through their coughing. It works the same thing with mumps and measles. It's through coughing. They're actually also spreading it. Maybe it has something to do with the fact that children touch their mouth. We all do. We touch our face and mouth all throughout the day, and it's possible that they're just kind of spreading it around by touching things after scratching on those vesicles. They touch something, including their mouth, and then with their mouth they cough or project the virus even further. All right, for whatever reason, chickenpox is airborne and contact. All right, hopefully I chatted that up enough so that you might burn into your memory here that there are several uh, conditions or communicable diseases that fall under both the airborne and some other contact precaution. But guess what? If they're on airborne, that PPE or barrier methods or any kind of protocols that you are following with the client supersede all the ones underneath it. All right. So airborne gets the most fastidious or the most careful treatment. And what will that be? Well, they're in a private room unless they are cohorting for cultured or um, otherwise verified lumbar puncture or whatever is needed to verify that they both have the same pathogen. You can cohort them in a room. All right. Gowns are not needed. All right. That's mostly for contact gowns. Gowns are not needed with airborne. Eye face shields are not automatically needed. Again, of course, unless there are it's required for your standard or universal precautions, okay? Yes to the special filter mask, N95, only for your TB patients though, okay? N95, only you don't wear the special filter mask for measles, mumps, rubella, herpes zoster, chickenpox, right? You definitely don't do it for that. You will do it for the folks with TB because that particularly is a lung disorder, all right? So those residue particles are going to cause a lot of damage if they can get into suspecting vulnerable waiting lungs. All right. So N95 is the way to go. The patient, though, wears a surgical mask when leaving the room. So the patient isn't necessarily wearing an N95. They are just wearing a surgical mask so they can keep limited to themselves their own, TB containing uh, what we call it, cough spray or sneeze spray. They're keeping it contained. All right. It's not essential to have disposable equipment. All right. It's not a bad idea, but it's not essential. And absolutely, they've got to have the negative airflow rooms or the negative pressure rooms. This is an important concept for you to know. The air sucks in a negative airflow room. You may even just notice that when you're going to close the door that it sucks in shut to keep all of the ventilation going into the patient's room and kind of out of the hospital. It generally works under a separate ventilation system than the rest of the hospital. So there's not an intermingling of the airborne um, communicable disease filled air with the patients of the hospital. So with that separate ventilation, there's a cleaning of the air that's happening, right? And with the pressure lower on the inside than it is on the outside, there's a performing of 6 to 12 air exchanges that's trying its best to keep the particles as low as possible. So we're not completely scrubbing the air, all right? So keep that in mind. If you are the nurse planning to assign that room to another patient, particularly if that other patient is immunocompromised, all right? So in other words, don't assign an immunocompromised patient in a room where an airflow or an airborne communicable disease like TB or one of the others that I mentioned, patient was in that room, right? If a person with an airborne disease was in a negative pressure room, you're certainly going to think about who you assign to that room after they've left, because again, the air is not completely purified. The room has to continue on with this 6 to 12 air exchanges per hour, probably for a couple of days or as long as possible after the former patient, to ensure that the room is clear of those pathogens, okay? Especially though, if you have a vulnerable patient coming in behind. I want you to keep that concept in mind because we've got some practice questions that'll kind of trigger you to think about that as well. All right, keep the door closed, not this 3 feet stuff or keeping the door ajar like you can do with the droplet precautions. Close that door, okay? It's already wanting to suck in anyway, so keep the door closed, okay? Now, PPE donning and doffing. Now, you know what donning and doffing is, right? It's applying or putting on the gloves or PPE versus removing or taking off the gloves or other PPE. All right, do you know the conventions for NCLEX? All right, the NCLEX way, because I think we may have some differences or variations in the ATI and or HESI way. Let's think about it the NCLEX way. All right, always take off in A, B, C order. And what's the alphabetical order here for doffing? PPE. All right, GLO, GOG, GOW, and mask, MAS. All right, so gloves, gown, and mask. This is how we're going to doff the PPE. All right, now gown, mask, goggles, and gloves. So reverse alphabetical order, where the G's are in reverse ABC order, with the M coming second. Can you remember that? All right, reverse ABC order. So gown, goggles, gloves, right? But shove mask in the second position and you're good to go. All right, some things we just memorize, all right? And since it could be different from what you learned when doing your exit exams, then you definitely want to assure that you have the NCLEX way burned into your memory, just in case you get one of those questions where you have to put things in order. All right, and the order that you would be assigning things would have to do with PPE. All right, so as I showed you before, there are some transmission-based precautions. Mnemonics here. My chicken has TB. You heard of that one? My chicken has TB. It helps you keep up with the airborne issues. The my is for measles. The chicken is for chicken pox or varicella. The hez is for herpes zoster, or shingles, and then TB. All right. So varicella, herpes zosters, measles, and TB. Those are 4 airborne diseases that you could just have if you have that mnemonic in mind. Or you could try MTV. Measles, TB, and varicella, MTV. All right, that could be helpful. We already talked about the Spider-Man droplets mnemonic, right, and all the many ones that are included there. And then finally, let's talk contact precautions, which are fewer than the droplets. All right, Mrs. We. All right, Mrs. We. M for multi-drug resistant organisms, so that you don't forget draining MRSA wounds, right? Will be contact. Respiratory infections will be on your contact precautions, particularly RSV. Okay. Skin infections are there. That's going to be all your little, we mentioned before, your MRSAs, your VERSAs, your draining wounds. W for wound infections. Right? There's kind of a theme here with the S, the W, and the M. Like they're all we're really kind of thinking about draining wounds. E for enteric infections, including C. diff, and then another E for eye infections, including conjunctivitis. All right, so those are helpful. B chips, you heard of that one? It's got to break down the skin infections mentioned in Mrs. Wee. So the skin infections, varicella zoster, cutaneous diphtheria, meaning the skin diphtheria, right? H, herpes simplex, I don't know why I put a Z there. Just throw it here. I for impetigo, P for pediculosis, and then finally S for scabies. So, I don't know, something to think about if you want to think through the contact precautions and have a little something to work with there in case you get one of those questions asking you to select all that apply. Perhaps it wants you to take a look through some given options and decide which ones are contact versus those that are airborne versus those that might be both. We don't know how that question might look, but it doesn't hurt to just make sure you're covered in that department.